Hello. Are we? Hello. Okay. A very warm welcome to all the expecting mothers. I am Dr. Nitu Singh, consulting obstetrician and gynecologist and infertility specialist, practicing in Dahisar East, Mumbai. Today, I will be discussing a very common topic, a very common problem rather, which we face in pregnancy. That is aches and pains during pregnancy. We all must have experienced some kind of minor to major ailments during pregnancy. छोटी मोटी दर्द कोई ना कोई नॉन स्पेसिफिक तकलीफें होती रहती है जिसके वजह से we keep going to our gynecologist. In short, the joys and pains of motherhood do not come without the aches. Patients encounter a multiple panorama of these problems, which can be normal changes of pregnancy to alarming ones. See, in pregnancy, the patient puts on weight, the expecting mother puts on weight. There is water retention. There is certain amount of postural changes that happens during the 9 months of pregnancy. They may occur because of hormonal changes also, and also because the entire body, ligaments, skeletal muscles become loose. Many a times because of hormonal problems, there are mood swings also, which the patient encounters during her pregnancy. The most common symptoms or other ache which will be discussing right now is backache. Backache is a very common symptom in pregnancy. It usually includes the tailbone, which occurs due to ligament relaxation. This ligament relaxation is there in order to accommodate the growing fetus inside the mother's body. What is the management? Management is very simple. You can change your footwear. If you're wearing heels, start wearing low heels, or try sleeping on a firmer mattress. Preferably sleep on the left side, the left lateral position, because इस position में baby का blood circulation अच्छा होता है. You end up giving more blood to the baby and therefore help or assist in the baby's growth and development. Avoid bending for picking up things for the ground. Usually squatting position is preferable. Whenever it is possible, preferably lift your body rather than bending and picking up things. The second symptom which is usually encountered, which I'll be discussing, is leg cramps. Leg cramps is more common during the second trimester. When I say second trimester, it means from the fourth, fifth, and sixth month of pregnancy. It usually occurs more during the night. Patients usually आके कहते हैं कि भाई हमें नींद ही नहीं आ रही है. Patient हमें आके कहते हैं कि नींद नहीं आ रही, but most commonly इसलिए नहीं आती क्योंकि पैर में heaviness लगता रहता है, एक uneasiness सा लगा रहता है. Simple management है. You have to stay active, keep doing minimal exercises, keep yourself fit, keep yourself well hydrated. Hydrated माने जितना हो सके fruits पीना है, juices, soups, any liquid that is available has to be taken. And stretch your muscles before getting up from the bed. Usually do not just jump out of the bed. Little exercises has to be done on the bed before you start your routine in the morning. The third symptom is abdominal cramps. Abdominal cramps are common in the first trimester, first, second, third month, which occurs because of the growing pregnancy. But if it is more frequent or if it is painful, you should visit the gynac because then it's an alarming sign. यानी कि कोई दिक्कत है, we have to take care of it. Many a times we usually give patients hematinics. When I say hematinics, I mean we give them iron supplementations in order to build up the hemoglobin. कई बार उसके side effect के कारण भी patients को abdominal cramps होते हैं. So basically, if there is any abdominal pain, visit the gynac, discuss the problems with them. Accordingly, we either give you treatment or we change the hematinics, or it can also occur because of constipation. So in that case, we might give you syrups or liquids so that you have a clear bowel. The next symptom which I will be discussing is headache. Headache usually occurs because of lack of sleep and also because the patient usually in the first 3 months has nausea, vomiting, dehydration. Answer is simple. Go for few relaxation techniques, either in the form of yoga or listening to music, or if you feel like reading a book, whatever suits you, you have to go for it. Baseline is keep yourself well hydrated and simple. Paracetamol tablets are good to take care of headache, but obviously any medication which you take during pregnancy will be under the supervision of your gynecologist. Next is dental ache and pain. Many patients usually come with दांत का दर्द, either वो पहले से ही problem रहता है or it can be a new problem. We usually tell them to seek opinion of a dentist. First 3 months, that is the first trimester, the patient is asked to avoid any dental procedures. Other symptoms like gingivitis, stomatitis, ulcers and all these come during pregnancy, which can be tackled very simply by giving simple multivitamin supplementation under the supervision of your obstetrician. The other symptom that I'm discussing right now is pinched nerve, nerve compression. In general, during pregnancy, a normal woman puts around 8 to 12 kgs of weight gain. Some may put slightly on the higher side also. As a result of which, there is water retention. Patient खुद आके बोलती है ऐसा लग रहा है बदन में पूरे शरीर में पानी भर गया है, खिंच रहा है. It is normal. We cannot get away from it, but yes, we should not be allowing the patient to suffer because of such a symptom. Then answer is you have to meet your gynac, take good calories, do not allow yourself to put on excess weight, and symptomatic treatment either in the form of some multivitamin or some splint the doctor may end up giving you so that you are comfortable during the rest of the course of your pregnancy. Another common symptom encountered is swollen ankle and feet. It can be physiological edema. When I say physiological, I mean it can be a normal symptom of pregnancy. जैसे सूजन आना is normal, or it can be because of low protein diet, or it can be something alarming because of a very high blood pressure. See, basically we'll have to find out the cause in these cases, why the patient is having these kind of swollen feet, and accordingly we'll be giving you treatment. In case if swollen feet is just a part of your normal pregnancy, answer is you just have to keep your legs elevated, wear compression stockings, keep yourself active, wear loose clothes, and if preferable, wear socks or stockings at home or during your work time. And if there are other reasons like low protein or a high blood pressure, accordingly, your gynecologist will be treating you for the same and guiding you for the same. Swollen tender breast is another common symptom which patients encounter during pregnancy and also after pregnancy. In such cases, the patient, usually I ask my patients to take good nipple care before she delivers, जब पता है pregnancy तब से you have to take care so that at the end you don't end up with swollen nipples. In these cases, it is very simple to manage. Just apply a simple petroleum jelly over your nipple area. Keep it well moisturized so that you don't face problems of cracked nipples, and so that after delivery you do not end up keep meeting your gynecologist for these kind of minor ailments. Heartburn is also very commonly encountered symptom during pregnancy. First 3 months, patients have a really bad time because of the hormonal changes that occur. They keep getting burps. They commonly call it acidity. Answer is you have to alter your food habits. If you're possible to eat well. If no, no harm. Keep yourself well hydrated. Another common symptom is varicose veins. नसें फूल जाती पैरों की या फिर hemorrhoids यानी कि piles. Patients usually come with it. ये usually second trimester में होता है यानी कि third, fourth, fifth month of pregnancy because of increase in the blood volume and also because of certain hormonal changes in the body, the patient end up getting hemorrhoids. Answer is avoid long standing, keep limb elevation. Long standing work है तो in between keep positional changes, and in the diet keep a high fiber diet so that you do not end up with a hemorrhoid or a piles. The next symptom is joint pain. It is very simple because sudden weight gain increases and the entire pressure is on the spine. Patients feel joint pain. Treatment is simple. Take local gel application or hot water bag or even those electric heat pads you get is good and safe in pregnancy. Yeah, if still the pain is not controllable, we have to go for and search for an underlying cause, and accordingly the treatment has to be given. So in short, I have tried to cover all the aches and pains encountered during pregnancy. I am open for any questions from the audiences in case there are questions. Yeah, I have a question from an audience that what to do for backache during the last trimester. See, last trimester means you're having backache, you're talking about backache in the 7th, 8th, and 9th month of pregnancy. In these cases, symptomatic treatment like a hot water bag or an electric heater or any local ointment is good. And I usually I ask my patients to do certain physiotherapy or back strengthening exercises from the second trimester itself. Because it prepares the body for normal labor and also for the normal pregnancy to accommodate the pregnancy. So, firstly, in prevention, exercise is the answer. And once you cannot avoid it, you started getting the pains, answer is local gels, ointments, or hot water fermentation. And in case with the backache, you have any amount of abdominal pain, you should visit the gynecologist because it can be a symptom of preterm labor also. So backache has to be taken seriously in the last 3 months of pregnancy. Any other questions? There's another question from an audience saying that I have just entered the second trimester but daily back pain issues. What to do? I have one baby of 3 years via C-section. See, Ritu, this C-section, I understand spacing is of 3 years and you're pregnant again. Answer is, as I just explained, backache is going to be there. You take good diet, take milk, calcium supplementation. If possible, once the backache is relieved, try doing stretching exercises so that there is enough space to accommodate the bachu, the baby inside. There's another question. When should I worry about abdominal pain during pregnancy? Any abdominal pain which is frequent, which causes hardening of the tummy, or which is associated with any amount of bleeding or leaking. When I say leaking, I mean some watery discharge. You need to visit the gynecologist. See, another question, is it safe to bend during pregnancy? It's a strict no. In fact, I will put it this way. Bending is actually a wrong posture, whether we are pregnant or non-pregnant. Preferably try squatting, that is sitting down and picking up things. Squatting is always preferable over bending down, irrespective of pregnancy. Another question, is 12 weeks too late for first prenatal visit? If you ask me, yes. See, there are many things which we need to know by around 9 to 10 weeks so that we can take the due precautions and certain blood tests. If there are any problems, we can correct it. So preferably visit the doctor as and when you realize you are pregnant. Another question, can I sleep on my right side while pregnant? You can, but preferable position is the left side. First 5 months, irrespective of your position, the baby is getting its good blood circulation. After the 5th month, preferably try sleeping on the left lateral side. There's another question coming up. Can you explain about bleeding gums in pregnancy? See, bleeding gums can be because of poor oral hygiene, or it can also be as a symptom of vitamin C deficiency. You need to see your gynac. He or she will do your clinical checkup, put you on vitamin supplementation, and obviously, if required, anything to be required or suggested for oral hygiene, that will also be advised to you. Feeling faint in pregnancy, is it normal? Should I take care during these days? Yes, feeling faint is not normal. It indirectly suggests that either you are having blood pressure issues or probably your hydration is not well. And fainting down or having a blackout in a public place or even at home is very risky because it may harm you or the fetus inside. You don't have to take it lightly. You have to visit your gynecologist for this symptom. Headaches in pregnancy, I just feel like to sleep. Another question. See, headaches, again, answer is hydration and keeping good glucose levels, which I mean to say is you have to be very well fed. If you feel like sleeping, yes, in the first 3 months, patients usually sleep a lot in the first 3 months because they don't feel well. They have nausea, vomiting, ulti, chakkar, सारी चीजें चालू रहती है. Patient को in general happy feeling आती ही नहीं है कि भाई उठ के कुछ कर लें. First 3 months में normal है, थोड़ा ज्यादा नींद आना. Headache, yes, हल्का फुल्का है, you can take Dolo 650 or paracetamol, but अगर ज्यादा है, you have to go to your gynac. She will check your blood pressure and accordingly put you on medications if required. Any more questions? Yeah. Any more questions? Yeah, there's a question which just came up. What is some bad signs during? I can put it down in 4 to 5 points. Anything, any pain which is not getting relieved, any discharge, you have to, without a second thought, rush to your gynecologist. Anything else? Any more questions? What pain should I worry about in early pregnancy? See, in early pregnancy, abdominal pain is one issue for which you should visit the doctor. Otherwise, mild aches and all, I have just discussed. उसे कैसे टैकल करना है वो भी डिस्कस हुआ है. मिनिमल चीजों के लिए हर बार दौड़ के जाने के लिए जरूरत नहीं है डॉक्टर के पास. If there is anything major, you can definitely see your gynecologist. So I think that's enough from the audience questions. If anything, please let me know. So basically, my take-home message is with motherhood, many problems keep coming up. If they are minor in number and amount, we can manage, as I've just discussed. If there's anything, we are there. We means I'm talking about the gynecologist or your respective obstetricians. You can visit us for anything if needed. Thank you. Thank you so much.